Hello everyone, welcome to my channel Study Nursing by Sense Course. Today in this video we are going to learn about cardiac glycoside. In this video you will learn about example of a cardiac glycoside drug along with its antidote. I will also introduce to you a couple of nursing intervention, and this video let me be in telling you in particular that this is intended as a guide for the nurses when they go to the clinic or when they are students preparing the drug study, and it is not intended for any active medical treatment. All right. So that being said, let's jump on to the video. So what do you mean by cardiac glycoside drugs? So they are the medications used for the heart failure. They are the drug of choice for the heart failure. What does it does do? It increases the myocardial contraction. So when I say that, they decreases the movement of sodium and potassium and increases the movement of calcium ions into the myocardial cells. So when the calcium moves into the myocardial cells, they contract with much force. So that is what is meant by increasing in myocardial contraction. All right. And when they do this, they increases the blood flow, right? So the heart pumps faster. As a result, the blood flows all over the body, including kidneys. So when the kidneys start functioning in much better way, it causes diuresis and thereby reduction of edema or reduction of swelling. So as I was telling, these drugs are intended for heart failure, especially when I say these are the drug of choice for congestive heart failure. They increases the myocardial contractibility, thereby increasing the blood flow and thereby causing diuresis and decreasing the swelling. And they also decreases the heart rate. How do they decrease it? Because they activate the parasympathetic nervous system and decreases the sympathetic tone. So the heart rate increases when sympathetic nervous systems are activated. So they favor the parasympathetic nervous system that causes the decrease in the heart rate. So this is a function of cardiac glycoside. When we talk about cardiac glycosides, it's very important that we talk about the loading dose and maintenance dose. Since it is not a medical class, it's just a nurse's presentation. I will not give details on the loading dose or the maintenance dose, but it's very important as nurses we know about what do you mean by loading dose and what do you mean by maintenance dose. Loading dose has more dose compared to the maintenance dose, especially when we start the drugs such as digoxin or clopidogrel or an aspirin, and any anticoagulant drugs. So when we start those drugs, we start with the loading dose and it is followed by some maintenance dose. So loading dose has got more concentration of the drug, which is much higher in percentage, and a maintenance dose is a small amount of medications that we provide to the patient to ensure that it is that level is maintained in the bloodstream. All right. Yes, so as a result of this glycoside drug, what happens to our body? It decreases the venous pressure, it increases the coronary, it dilates the coronary blood vessels and marked diuresis and reduced edema. I've already explained to you what happens when we take the drug, so I hope you understand the meaning with this slide. Let me take you through the indications. So, what are the indication one can have the cardiac glycoside or digoxin? The main indication is CHF for congestive heart failure, and the second indication can be cardiac arrhythmia, such as sinus tachy or atrial fibrillation or atrial flutter. All right, but it's very important to say about the contraindication. When a patient is hypersensitive to the drug, especially when they have renal failure, low potassium, and in elderly, these drugs should be taken with caution. Next, we have the side effects of the drug. The first and the foremost side effect is toxicity. So, dear all, make sure that digoxin is being prescribed, whether it is IV or in the tablet form. We look for the toxicity because it might be fatal and it can even cause death in the patient. There are also instances in which this drug has caused cardiac arrhythmias followed by cardiac arrest. All right, so it's very important. And do you all remember when I said that this drug causes a decreased heart rate? So that is one of the side effects of the drug. So it causes bradycardia. All the other signs and symptoms, you can have a look at the slide and understand. But mainly, I would say nausea, vomiting, diarrhea, and visual disturbances are, some of the most remarkable side effects of this drug. Let's move on to the drug interaction. So, if a patient has antacid, it should be taken in with caution, or the doctors consider what would be the alternative if they have antacid, as well as if they have, diuretics such as furosemide that causes the potassium loss. Loop diuretics, all right, they are the loop diuretics that causes a loss of potassium. So in that case, doctors might want to consider potassium sparing diuretic. All right. So these are the drug interactions digoxin can have in the with the other drugs. Let's talk about digitalis toxicity. So whether you're a nurse preparing for any licensure examination, or whether you're a student, or you're just a nurse, it's very important that you understand what is digitalis toxicity. Digitalis toxicity is a side effects of digitalis therapy. Remember, this preparation is actually derived from a plant alkaloid and it can be fatal. So it's very important that you monitor the patient for the toxicity. And it happens when the patient takes too much drug at one time, or the drug builds up over the period of time, especially when they have other pathological condition such as an existing renal condition or an existing liver condition. Yes, so these are the chances one can develop the digitalis toxicity. What are the predisposing factors? Just now I have told. In the liver disorder, it's mainly the organ associated with metabolism, right? Metabolism of a drug. So when they have a disorder existing, the drug will not be metabolized, and as a result that builds up in the body and cause toxicity. And the second one is the loss of potassium. It's very important that the patient has optimum level of potassium, especially when they are on this drug. What could be the loss of electrolytes in the body? What all are the reasons, or what all are the conditions where we lose electrolyte from the body? When we have excessive nausea and vomiting, when we have nil by mouth conditions, when we don't take potassium at all. I mean, especially in this case I'm speaking about, and also when we have suctions, gastric suctions especially. So these are the conditions of losing potassium, and these are the predisposing factors of digitalis toxicity. I hope until this much is clear for all of you. Next, we move to nursing intervention. In nursing intervention, I've prepared a couple of slides which is easier for you to understand. So first, let us look on the orders. There should be clear order, and the dose especially is very important. Sometimes in your ward or in your hospital setting, you might not have the right concentration of the drug. Sometimes you may need to cut the tablet into two. um, it might happen that you commit an error, and as a result the patient gets a double dose, if you know what I mean. So it's very important that you check the order correctly along with the dose. And in some cases, when the doctors check the blood level of digoxin and they find out that it's much higher, they might order for holding the drug or giving the drug in a decreased dose. So it's very, very important. I hope you don't forget this at all. And after the watching this video, you're very clear about it. Check the dose and check the order. Make sure that you're following the order accurately because it's of paramount importance. The second important thing that I can tell you is to check the pulse and do not administer if it's below 60 beats per minute. And also desirable that two nurses check the pulse, escalate it to the doctors or a medical practitioner, and follow the orders which are given by them. All right. The third important thing is the blood test. In the blood test, usually when your patient gets digoxin, they monitor the level every day, and monitor the level of digoxin as well as monitor the potassium level. All right, so they might have a routine blood along with the digoxin level test every day, or according to the condition, I would say. So these are the three main nurses intervention. At the same time, you can also observe that your patient, especially when they have any cardiac condition, they might be put under the intake and output monitoring. They might also have daily weight monitoring. It is to ensure the progress of the condition and also the effect of the medication they are getting. It's also important that we talk to the patient and we scrutinize whether adequate potassium is being taken. If the patient is too sick, the doctors might consider potassium supplements for them, or else we as nurses can educate them to ensure they are taking some bananas or oranges in their daily diet. So this is what is included in the diet alteration. And most importantly, teach the patient regarding the signs and symptoms of digitalis toxicity. This is applicable especially when you discharge the patient. Teach them that when they have nausea, vomiting, any visual disturbances, or dizziness, they can, they need to actually check with their healthcare provider, because that could be the signs and symptoms of digitalis toxicity. All right. And that being said, I'm going to take you through one of slides that shows digitalis preparation, that is injection as well as a tablet form. So from this you might have understood that digoxin or cardiac glycoside drugs are either given per oral or given intravenous, depending on the condition and depending on the orders of a patient and orders of the doctor. Lanoxin, the preparation comes in, as I said, tablet form as well as IV form. It's a drug of choice for CHF, for congestive heart failure. Dose, I would, even though I've written the dose, it's very important that you check with the latest drug manual and learn about the dose which is accepted in your country or the organization or the setup. Next, you see on the slide Digibind or Digoxin Immune Fab. This is the antidote of digoxin. So when you learn about cardiac glycoside, when you learn about digoxin, you also learn about Digibind at the same time, because when you have digoxin preparation in the ICU, especially, you have a Digibind as well as as well as Digibind. The class is digoxin antidote, and the action is it binds the digoxin and it makes sure that this is excreted through the kidneys. And the uses, obviously, when the patient has overdose and when the patient is in toxicity. So with this, I hope you have understood about cardiac glycoside, the uses. Make sure that you see this video a couple of times, or if you are someone who intends or plans to work in the cardiac scenario, you make sure that you watch this video a couple of times and make sure that it is thorough in your mind. I really want to thank you for your time, for watching this video. Make sure you share this video to somebody whom you think can benefit, or to somebody who aspired to become a nurse. All right, so that being said, see you in the next video. Thank you so much for your time.